Hi, today I'm going to talk about Taxol, otherwise known as Paclitaxel, which is a chemotherapy drug. And my name is Emily Wu. So Taxol's mechanism of action is that it inhibits depolymerization of microtubules during cell division, and this is most important during metaphase. Taxol stabilizes microtubules against cold temperatures and calcium treatment, which are both ways to depolymerize microtubules. And it reduces the critical concentration for polymerization, which means that you need less tubulin to cause polymerization of microtubules. It also stabilizes GDP-bound tubulin. So the process starts with Taxol first binding to beta tubulin, and typically there is one Taxol molecule per tubulin heterodimer. It binds at the taxane site, which is a hydrophobic pocket between the protofilaments. This leads to structural modifications of microtubules, which include lengthwise conformational changes, which lead to longer tubulin molecules. And it also modifies the curvature between protofilaments, which leads to fewer protofilaments. All of these modifications lead to more stable microtubules. Taxol also has some minor mechanisms of action which also lead to apoptosis, such as it phosphorylating or inhibiting BCL2, which is an apoptosis inhibitor that leads to apoptosis, and induction of IL-1 beta and tumor necrosis factor alpha upregulation, which also leads to apoptosis. So the pathway that Taxol interferes with is mitosis, and it leads to apoptosis of cancer cells. So since cell division requires microtubule assembly, as you know, especially during metaphase, Taxol suppresses microtubule dynamics and suppresses detachment from centrosomes. So it leads to mitotic spindle assembly defects and chromosome segregation defects. So the most prevalent theory is that unattached kinetochores will lead to metaphase arrest at the mitotic checkpoint, which leads to apoptosis or G0 phase. And so that's illustrated by this figure. So as you can see, the microtubules form the spindle from the centrosomes to the chromosomes, and Taxol will create unusually stable tubulin molecules, which will stack and fail to depolymerize. So that leads to the cell remaining frozen in metaphase, and it cannot proceed to anaphase. Instead, it will apoptose. There is an alternate theory that instead multipolar spindle formation will lead to chromosome missegregation, which leads to apoptosis. So as you can see in this figure, there is multipolar spindle forming as opposed to the normal bipolar spindle. And so the chromosomes get missegregated, and in cytokinesis, there is partial cytokinesis failure, and it leads to apoptosis with multiple cells forming. So the difference in mitosis between normal cells and cancerous cells is that cancerous cells have much higher rates of cell division. So they spend more time in mitosis, and that leads to them being more sensitive to Taxol. So the major side effects of Taxol are mainly due to Taxol-inducing apoptosis in rapidly dividing cells. So rapidly dividing cells will spend more time in mitosis, which makes them more sensitive to Taxol. For example, hair cells, which leads to hair loss, and blood cells and bone marrow, which leads to bone marrow suppression. Neutropenia is very important in that it is the abnormally low count of neutrophils. So that can lead to an increased risk of infection because your immune system will be down. And all these side effects can be controlled with the appropriate Taxol dosage. Another big side effect is multi-drug resistance, in that cancer cells will no longer respond to Taxol and other drugs. This is mainly caused by P-glycoprotein or PGP overexpression. So PGP is a transmembrane pump, and cancer cells will use it to pump out the drugs, so that reduces cytotoxicity and the cancer cells can avoid apoptosing. So Taxol is a substrate of PGP, which is why it leads to PGP overexpression. And PGP is coded for by the MDR1 gene, or multi-drug resistance gene. So another mechanism may be that Taxol induces mutations in beta-tubulin, which can lead to Taxol resistance, but currently the mechanism for this is unknown. So my question is, why might mutations in beta-tubulin lead to Taxol resistance in cancer cells? So just what are your theories for why this would happen? And these are my references. Thank you.